Good morning. I'm Derek Hirsch, a project leader with the Rural Health Transformation Center. Thank you to those who participated in our test poll. I'm excited to see all of your responses, especially those who have a well-seasoned coalition. We have other polls pop up throughout the webinar and appreciate your participation. And feel free to enter questions into the chat pod at any time or via the Q&A in the menu bar. We'll leave some time at the end to answer questions. This is the third webinar in our series, From Sticking Point to Tipping Point, Overcoming Rural Community Health Improvement Challenges. The previous two webinars are available for viewing on our website, mhifpopulationhealth.org/RHTC, which I just dropped into the chat. There will also be a recording of this webinar available tomorrow afternoon, and you will receive a link in your email. Now on to the main event, helping leaders move from buy-in to ownership. We all talk about community buy-in and understand how important it is in getting the community behind a community health initiative. In this webinar, you will learn why the Heart of New Ulm project changed the narrative from community buy-in to ownership, and why that is important for sustainability. Here to share some lessons in creating a sustainable model through the Heart of New Ulm project is Cindy Winters, the project advisor to the Heart of New Ulm project with the Rural Health Transformation Center. Cindy, the floor is yours.
Thanks, Derek, and thank you for everyone for joining us today to gain some insights into helping leaders move from a buy-in to ownership. The health issues that we face are complex, and it takes a diverse partnership to address the issues. So today we're going to talk about how to get to community ownership and why there is an important distinction between the two. We're also going to talk about how community ownership relates to sustainability, which has been a hot topic in recent years and something we all must consider when starting this work. The concept between buy-in versus ownership isn't necessarily called out in the literature when working with coalitions, but it is a fairly new concept. If you've worked with coalitions for several years, you're familiar with the need to get the community support behind an initiative. You need their buy-in for it to be successful in a community. During this webinar, we're going to talk about how important it is to develop community ownership in order for the initiative to be sustainable. I'll give you some quick tips on creating that community ownership. But first, we want to know a little bit more about your work and where your coalitions are in the buy-in versus ownership continuum. So the first question, on a scale of 1 to 5, how involved do you feel the community is in your community health initiative? Highly involved, moderately involved, fairly involved, occasionally, or not involved? We'll give you a few minutes to answer this. And it looks like right now the majority say occasionally involved, and there's a tie between fairly involved and not involved. So let's go to the second question. So do you feel the level of community involvement and engagement will help to sustain the project long term? Yes, no, or you're not quite sure? Okay. So 67% of you think that it is involved enough to keep the project going long term, and about 25% aren't sure. And 8% I think are really being honest with themselves saying no. So, okay, we have one more question. So, do you have community partners or residents that take responsibility for various aspects of the work or the work plan? Yes, no, sometimes, or you're not sure? Okay, 64% say sometimes that the partners take a lead role, which is good. And that's what you really want for sustainability. All right. So let's just jump right in. So I'm going to share some lessons learned from the Heart of New Ulm project, a 10-year research demonstration project in New Ulm, Minnesota to decrease heart attacks in the 56073 zip code. New Ulm is a small rural community of about 13,500 people, located 90 miles southwest of the Twin Cities. The project began in 2009 and the research portion ended in 2018. I'm happy to report that the project is still going strong in New Ulm and is being led by a community leadership team and several action teams doing the work. So how were we able to accomplish this sustainable model? We'll share with you some of what we did right and what we didn't do right. I think it's important to understand how we started to address sustainability in the middle of the project rather than at the beginning. When I started with the Heart of New Ulm project in 2012, I interviewed all of the steering committee members to gain an understanding of the project, what their organization thought of the project, and to understand their role on the steering committee. When I asked them about the Heart of New Ulm project, about 50% of those interviewed felt that the project was a program being offered by the hospital, and they participated because they wanted to support the hospital. The other 50% understood they had a role to play in the health and well-being of the residents of New Ulm. It occurred to us then that we had to shift the narrative. A program offered by the hospital that had a lot of community buy-in wouldn't be sustained after the research. The community needed to own the initiative and think of it as theirs. That concept is sustainable. Sustainability from the beginning. That's the first lesson. Just as you develop your evaluation plan in the beginning, you should also think about sustainability. Framing up your work through a sustainability lens will allow you to develop a plan that the whole community can get behind and maintain. When considering sustainability from the outset, these are the points that you need to take into consideration. Create an agenda around common values and goals. Define partners' roles and responsibilities. Cost share with partner organizations. Consider how the interventions or strategies you're considering can be integrated into the existing community structure. Think beyond biometric health measurements as your outcome measurements. Develop a comprehensive communication strategy and identify the training needs in the community to build the capacity of the members to address the issues. Spread the wealth of knowledge. I also want to be clear that not all activities or initiatives need, nor should they be sustained. Sometimes you need to do activities just to get the ball rolling and get some excitement in the community. But it's important to understand that from the outset. Oftentimes we get stuck in a rut and continue to do things that no longer have a return on our investment because that's how we have always done them. So moving from buy-in to ownership provided us with the opportunity to shift from having a large steering committee structure that met quarterly to a leadership team structure that meets monthly. I say opportunity because change is hard, and some organizations may be dropped from the committee, and explaining the reasoning behind the change is important. The leadership team is made up of 12 members, and the leadership team may look different in all your communities. This is just how we set it up in New Ulm. The membership criteria was developed by the larger steering committee before it disbanded. Membership consists of 6 organizations that have a standing seat at the table: the city, schools, medical center foundation, the chamber, and public health. And community members that represent organizations we partner with or community members that have the skill set that we're looking for on the leadership team. It's important to build a strong foundation for that leadership team. They need to understand each other's motivations, what brings them to the table, what they expect to get out of their participation. The team also needs to understand their individual roles and responsibilities and the decision-making processes. Taking the time to build that strong foundation will allow the team to create an agenda around common goals and values. We talked about some of those strategies that the Heart of New Ulm used to build the foundation during our June webinar.
I get to be one of those community members that's on the Heart of New Ulm Executive Committee. Who's all on that? Well, you have everybody represented of the city, the hospital, the schools, community members, make a well representation of the different aspects of the community, come together to plan what should we be doing differently here. So we looked at what is important for kids. What's the most important we need to make sure we give them each day? What are we doing with them physically? We encourage them to walk to school or bike to school. Do we encourage healthy meals, healthy snacks? If the kids do walk to school in the morning or bike to school, their minds are ready. They've already physically done the exercise, ready to sit down and settle down for their morning routines in the classroom. So our job, if we're going to teach them academics, is to first get their mindset, get them ready. And being physically active is one of those keys.
So in this video clip, Jeff Bertrand, Superintendent of Schools, mentions that he's one of the leadership team members. Sometimes it's difficult for coalition leaders or facilitators to relinquish control and hand it over to someone else. And Jeff is always good about reminding us that this is a community project and we all have a role to play. So allow us to do our role in the best way that we see fit. After the leadership team was solidified and ready to take on the work of the project, they created action teams that address a specific issue the leadership team is interested in improving. One member from the leadership team serves on one or more of the action teams. The action teams are designed to be short-term teams. Once the issue is addressed, they disband or shift their focus depending on what the members and the leadership team decides is needed. If needed, other action teams are formed. It allows more community members to get involved with the work and share the responsibility across the community rather than one organization being responsible for the work. The Heart of New Ulm project currently has 9 action teams that were added gradually over time. It also sets up a cost-sharing model so the partnering organizations can also share their resources, whether it be financial or personnel or both. And as you can see, we have over 70 individuals that participate and support the project and 30 plus organizations. And when the project started, we just had 36 members as a part of our steering committee. So we've actually really almost doubled the number of people involved in the project over time. So when adopting a cost-sharing model, the foundation that you previously built with the leadership team is critical. All of the members understand what they're trying to accomplish, and this allows them to tap into their resources to help cover some of the costs associated with the overall work. Resources could be staff time, actual dollars, marketing or promotion, or educational materials, etc. Some of your partner organizations may have funding to do specific activities that fit into your overall plan, or they may have a donor that may be willing to cover the cost of certain projects or activities. This decreases the burden on one organization to fund the overall initiative, and it helps to spread the responsibility across the community, supporting the community ownership model. When determining which evidence-based strategies to implement in your community, you need to adapt them to fit to your community and your partnership. Ask the partnership how to do this. Who is going to lead the work and who else needs to be involved to make this work? Really taking a sustainability approach to implementation will ensure the project is integrated into the current existing community structure so it can be streamlined so it can be maintained long term. And this will also allow you to think about what measurable goals you want to track. When setting measurable goals, keep in mind what's important to community partners and members. We in the healthcare system generally want to track biometric measurements and health behaviors, but those don't always resonate with our partners. You need to have a good balance so that they feel some ownership in the work. These are the 8 basic principles of practice documented in the collective impact literature. Some of the 8 principles we talked about today are circled. In order to have a community health initiative that is owned by the community, you need to include community members in the collaborative. We have over 70 community members that serve in our action teams. We actively recruit members we know are passionate about the work or have a role to play in the development and implementation of our various strategies. This really allows us to customize the evidence-based interventions to fit our community and our resources, creating a stronger sense of community ownership. Taking a community ownership and sustainability approach when developing your initiative allows you to take a close look at community programming, identify duplication of services, and reallocate limited resources to fill gaps. This close look at the community allows you to take advantage of mutually reinforcing activities. I like to look at this through the policy lens. What programs are currently happening in the community that can be paired with a policy initiative? By taking this approach, it allows you to demonstrate to the community the need for the policy, especially in a community that's not familiar with policy work. By pairing activities with policy messaging, it helps to make the case for the policy and gain community support and ownership. I'd like to introduce you to Audra, and if you were on our last webinar, you met Audra before. She's the former Chamber of Commerce president in New Ulm. She was one of our first recruits to the steering committee and remained a member of the leadership team. If you noticed in the action team slide, we have a downtown action team that functions out of the Chamber of Commerce office. The goal is to revitalize our downtown, make it more vibrant, inviting area where residents want to spend more time. Having a vibrant downtown also increases opportunities for social connectedness and provides opportunities for physical activity by being able to walk and bike to the downtown area. This picture was taken when a health system came to New Ulm to help them understand and experience the Heart of New Ulm project firsthand. She spoke to them as a representative of the leadership team and provided them with these takeaways when working in their own communities. Do translate public health ease into business language. Do celebrate small victories. Do engage business champions. Don't give them the answers. Don't view them as an experiment or lab rats. Don't be judgmental, and don't underestimate culture and history. The Chamber of Commerce and the business community have really taken ownership of the Heart of New Ulm project. They feel it is critical to the community continue the work of the mission of the project because they see the value it brings to their businesses and their employees. When it feels like the initiatives and our measurements are getting too health system focused, they're quick to remind us that this is a community initiative and we need to present the information differently. It's important to build the capacity of community members so they can carry the messages, know where and how they can influence decision making, understand the evidence-informed or best practices, and get out of the habit of doing what they know and start doing what has been shown to work. To sustain an initiative, this needs to be a focus on policy systems and environmental change. Oftentimes, community members aren't familiar with or comfortable with this type of work and tend to go straight to programming. To help move toward PSE work, we brought in national experts to give presentations and provided trainings to residents. And when working on the built environment, conducting walk audits and creating human mini traffic circles or curb extensions allows residents to experience the effect on traffic when those traffic calming measures are in place. We've also brought in regional experts and sent community members to national and regional conferences so they can learn firsthand, network with others doing similar work, and share what they have learned with the rest of the community. The majority of this education has been around PSE. We've also brought in regional experts and sent community members to national and regional conferences so they can learn firsthand. It helps them to think differently about their community and allows them to look at it through a different lens. And it also allows them to network with other communities and visit with others doing similar work and get some of their questions answered by those who have been in similar situations. I subscribe to many different newsletters and articles that come across my desk. I often forward them that are relevant, forward them to the action team members, especially the ones that are really relevant to what they're working on. I really try not to inundate them with information so they know that when I do send them something, it's important and they should take the time to read it. So taking advantage of the expertise in your community or region really helps to build that leadership and ownership within the community. It only solidifies that sense of ownership. So this is one of my favorite quotes and motivations for doing this work. So don't judge each day by the harvest that you reap, but by the seeds that you plant. Robert Louis Stevenson. When I hear a community member repeat something I've shared with them or said to someone else, I know I've hit the mark. They've gained the knowledge and the confidence to spread the word and know they are responsible for creating change in their own community. And here's my contact information if you'd like more. We also have a link to our current website and a link to the registration for the upcoming webinar. So thank you for your time and attention. We love sharing our lessons learned. We have some time for questions. So Derek, are there any questions?
Not yet. We'll give folks a few minutes to come up with some questions and start with a few that we got during registration. So first, why do you recommend thinking about sustainability in the beginning?
I think it's important to think about sustainability in the beginning because it will help you design strategies or initiatives that can be maintained long term. If you create a strategy that can only be done once or twice, that's fine just to get the community activated and involved, but you really need to think about how those interventions can be sustained long term in order to for that community ownership.
Thank you. Another question from registration. Don't you need community buy-in in order to get community ownership?
You do need buy-in, and I think buy-in is really the first piece, and that's where some of those programming and just kind of launch type activities that you would do to get people to understand what's happening, why you started this initiative in the community, and to help provide some education. But you want to move beyond that buy-in piece, because if people are just coming to your activities to support the organization, that's not going to be sustained long term. And as we know, when you do activities, over time, you end up getting just about the same people. You don't reach new people, and your attendance tends to drop off over time as well.
Thank you. Another here from registration. I was at a conference recently where they recommended not bringing in national experts because it wouldn't be well received. Why do you think you were successful in bringing in a national speaker?
So the Heart in New Ulm brought the national speaker in 2013, and our project started in 2009. So we had built a reputation in the community. We had a brand recognition, and the community began to trust us and understand what we were trying to do. And we not only, before we brought the national speaker in, we also had several conversations about what it would be like if we were to start making changes in the community, especially around policy systems and environmental change. But sometimes those individuals really need to experience what that would be like. And I think having had that, laying that firm background or groundwork really helped support the need for that national leader to come in, because then they were ready to hear the conversation and get involved and support it.
We got a question in chat. Thank you, Ruth. It seems like an important complement to ownership is shared understanding or good communication about what else is happening. Can you talk about how you keep all 9 groups informed about what the other groups are doing?
So as I said before, and that is a great question, there's someone on the leadership team that serves on one of the action teams. So there's always that open line of communication between the action teams and the leadership team. And the leadership team gets an update every month on what's happening across all the action teams as well. And then the people that facilitate it help to keep those lines of communication open as well.
All right. And feel free, those on the line, to enter your questions into the chat box. You should see it popping up as we enter things in. But I have one more question from registration. Why is it important to send community members to conferences? Can't the facilitator just bring the information back and share it with the rest of the team?
Yes, they can. But I think having that personal experience, and I'll share a story. We sent one of our city council members to the Walk Bike Place conference 3 or 4 years ago in Pittsburgh, and she was able to go to different sessions of the conference that I also attended, but she went to different sessions. And one of the sessions, there was a mention of the Heart in New Ulm project, because the person giving the presentation had been the national consultant that we brought to the community. And so they highlighted the work that we had done in New Ulm. And I got a text message on my phone saying, I have news. And when I saw her later that day, she's like, we were mentioned at the national conference. They showed pictures of New Ulm. And she brought back information and went, as soon as she got back to New Ulm, she went to the Chamber of Commerce and said, we need to start doing this, this, and this. This is what I learned at the conference, and it really works in these communities, and I think we should start adopting it. So it really helps energize them and know that they're on the right track and gives them additional ideas. So it just helps to build that strong foundation and ownership piece as well.
Thank you. We have another question in chat. Thank you, Susan. How important was it to have that influx of funding at the beginning of this initiative?
I think that's was really critical. So then it allowed us to develop our brand and to create our communication strategy and get the word out about what it was that we were trying to accomplish and to really get the community behind us. And then over time, we were able to start doing the cost sharing model and shift a lot of the responsibilities over to the community members. And so now it's really is being sustained by the community, and they're truly bought in. They are, we're working on our next 3-year plan right now and having a lot of conversations about what our measurements should be, and they're really engaged in the process.
Great, thank you. Another question here. Thank you, Ellen. What are some other conferences that you recommend attending?
I mean, I think it just depends on what your community really is working on. There's a variety of different conferences, and all the organizations that sit around the table at on your leadership team or your action teams, I'm sure that they get notification of conferences that they have maybe participated in. Your local public health department can let you know other conferences that are going on. Your state health department, also, they send staff to conferences and they can recommend which ones are really good and get a lot of information from. Special interest groups often have conferences. I can't really recommend a particular conference without knowing what your primary focus is and your reason for attending.
Great, thank you. Another question here. Thank you, Joe. You mentioned that it is helpful for the council members to know each other's motivations. Do you have any recommendations based on your experience on how to do this with different community partners?
I think the last webinar, we really talked about when you bring leadership team members to the table. Before you do, it's really important to interview them so that you do understand what their motivations are. We don't interview all our action team members, but we really do interview all of our leadership team members so that we know that we have the right people at the table, we have the right networks at the table, and that they can help us understand who some of the action team members are, and they can recommend people that might be interested in joining the action teams as well.
Thank you. One more question. Thank you, Rebecca. Can you talk more about how you integrate data and outcome measures into your sustainability strategy?
Thanks, Rebecca. That's a great question. So we really look at our data, and depending on who our audience is, we create different fact sheets or present the data differently depending on who our influencers are and the messages that we're trying to get across to the community. So it supports our initiatives throughout our project.
Thank you. Well, we've got just a minute left here, so I'm going to put up one more poll that you can answer if you'd like. Otherwise, I've got a bit of a housekeeping items. Once again, thank you for joining us. You can get more information about the Rural Health Transformation Center and access all of our tools and resources via the URL in that chat pod. Again, that's mhifpopulationhealth.org/RHTC, which I'll pop in there again here. And via the link in the chat pod, you can also register for our next webinar, which will be on August 22nd from 11:30 a.m. to 12 Central Time, which is using telemedicine to reach your population targets. We also have 2 more webinars planned for this fall focused on the food environment. If you're interested in our work and would like to see more information, please indicate in this final poll and we'll reach out to you, or email us any questions that you have at populationhealth@mhif.org. And lastly, we would appreciate your feedback via a survey which will pop up once this webinar ends. And you will receive a recording link for the webinar tomorrow afternoon. Thank you all. Have a great day.